This 2-minute video will contrast and compare the interfaces of UpToDate and DynaMed, the two most used general point-of-care information tools available today. Starting from the Lane website, so lane.stanford.edu, you can find both UpToDate and DynaMed are found under Top Resources. Starting with UpToDate, let's take a look at appendicitis. This is a good example showing that UpToDate usually has multiple overlapping articles about a topic, and oftentimes you have to switch between articles to get a complete overview of a topic. Scrolling down this page, we have management of acute appendicitis in adults, and then clinical manifestations, and then something about children, and then something about management, and then diagnostic evaluation, and then pregnancy, and diagnostic imaging, and then something about appendectomy. If we link to management of acute appendicitis in adults, in this case we're presented with a What's New page, and then we can work our way through the article with the outline in the left column. One thing that's interesting and has changed of late is that we can see conflict of interest information about each author. Let's look at the same topic in DynaMed. The search produces what appears to be two articles. Let's look at the appendicitis in adults and adolescents. Here, everything is combined into one article. Once again, there's an outline of the article in the left column. Here we can find diagnosis, management, complications, prognosis, etc., etc. DynaMed also shows conflict of information. Appendicitis is a common entity which you would expect that both applications would have good information about. At the library, we were recently asked about a rare condition called Lemierre syndrome. Let's take a look at what happens with an uncommon topic. UpToDate gives us a single article, and then once again, clear outline, paragraph style, a list of references at the end, easy access to graphics. In DynaMed, once again, single article, similar indexing, bullet point presentation, links to related information, and then a list of references as well. As I mentioned in the accompanying blog post, we can feel fortunate to have access to both DynaMed and UpToDate through Lane Medical Library. I would strongly encourage you to explore both applications when you're finished with training and may no longer have access to this kind of information and actually have to decide to purchase it. You'll have an idea about which product you prefer. The final thing that I wanted to show you is that you can easily access information about how to gain access and add to your mobile device for both products. So if you go to Resources, Mobile Apps, and start to scroll down, there's UpToDate, there's DynaMed, and you can test them both out. 2 summary slides follow. In UpToDate, you'll find multiple articles about one topic, so picking where to start sometimes is a little bit difficult, and you have to read through several articles to get a complete overview of a disease process. Information is presented in a paragraph style. UpToDate has excellent breadth and depth of information, but does seem to contain more expert opinion than is found in DynaMed. DynaMed usually has a single article about a topic, and all of the information around that topic is grouped in one area. It presents information in an outline style, and it is more overtly evidence-based than UpToDate. If you have questions for us at the library, remember you can always get help at the library homepage by emailing a question to us. Okay, thanks.